Because the last few years have seen unprecedented recoveries stemming from healthcare enforcement efforts against healthcare providers, individuals, suppliers, manufacturers, a lot of people have wondered whether this is going to continue, and I think it will continue. I think it will continue and probably continue to accelerate, in fact. And I think there are a number of reasons for this. There are increasing numbers of whistleblowers who are bringing these cases. Whistleblowers are not only increasing in number, but they're increasing in type. And so they will continue to bring these cases. In many ways, they have driven the enforcement agenda. So they're a very key component in all of this. There's more money that's being devoted to health care now. And whenever there's more money, you can expect enforcement will increase. The laws are tightened. They've been added to. There are more laws than there were. So all of this in combination is inevitably going to lead to more healthcare enforcement. Added to that, the fact that the federal government and state governments are providing more money to enforce their laws, I think we can absolutely expect this to continue and increase. The government is going to be looking at the manner in which healthcare providers and manufacturers sell their products. They're going to be looking at the claims that are made. They're going to be looking at the incentives that are provided to sales reps when they sell, and they're going to be looking at the incentives that sales reps provide to those who purchase. I think we're going to be seeing increasing numbers of cases against manufacturers and providers, and even those who consult with or provide advice to manufacturers and providers. So I think that everything is going to be fair game. What should they be doing in response to this climate? Given the fact that the enforcement agenda is driven in many ways by whistleblowers and relators, we've been advising our clients to implement key TAM or relator or whistleblower avoidance programs. And we think this is appropriately placed in the compliance function, and we think that there are really definitely things that the compliance folks can do to lower the risks that they will be subject to whistleblower actions. They should also be looking, I think, compliance programs should be looking to work more closely with the HR function in their companies, because often whistleblowers are disgruntled employees or former employees, and so a closer relationship between the compliance folks and the HR folks, particularly when RIFs or other terminations are being contemplated, because you can lower the temperatures and you can take care of these issues in a way that will reduce the risk that you're going to have disgruntled folks seeking to bring these actions. Obviously, where a company receives a compliance complaint or an inquiry, it's incumbent upon them to immediately begin an internal inquiry as to what that's all about and determine whether or not there are issues that need to be taken care of. I think the three main takeaways that providers, suppliers, and manufacturers, those who might be subject to enforcement in this area, should be thinking about are the following. First, having active, robust compliance programs is really important, and if it's combined with a whistleblower avoidance function, even better. Secondly, understand that healthcare is sometimes counterintuitive and people may misinterpret what they think you're doing. Those people who are misinterpreting or misunderstanding can be your own employees, they can be former employees, they can be competitors, they can be patients. And if they misunderstand what you're doing, that can lead to problems for you. So try and minimize the risk of misunderstanding. And finally, be fair. Make sure that what you're saying to people is truthful, non-manipulative, and fully disclosing.